this I was going through the MCQs, and in pediatrics, when I was going through the MCQs, what are frequently asked in the nursing and the medical entrance pediatrics, in pediatrics, when they are going to ask you certain multiple choice questions, I found that there are certain questions what are related to the gestational period. So, what is the duration of the intrauterine gestational period, what is there? So there were certain multiple choice questions what were asked in the very exact form in one-liners MCQs. So I decided to make a video on this. So starting with, so today I will be mainly focusing upon the terms what are related to the gestation period and which form the basics of the pediatric. Whether it be pediatric nursing or it be the pediatrics in branch, some facts what we surely need to memorize is that first point is that is what is a low birth weight baby. So in the present scenario in India, the normal weight of the baby is somewhat about the average normal weight of a baby is found to be about 3 kgs. So if a baby is born with weight having less than 2.5 kgs of weight, if the average weight of a baby is found to be less than 2.5 kg, then the baby is termed to be as a low birth weight baby. Because in the Indian scenario, when we talk of the Indian scene, in the Indian scenario, we find that the baby, most common, the average weight of the Indian baby is found to be about 3 kg, and if a baby is born with weight having less than 1.5 kg, then the term what is called at how it is defined as the term what is given is very low birth weight baby. If a baby is born with weight less than even 1 kg, if the weight of the baby is less than even 1 kg, then the term what is given to it as extreme low birth weight babies. And if the baby is weighing more than 4 kgs of weight, more than 4 kgs of birth weight at the time of the birth, if the baby is weighing more than 4 kg, it is referred to as a big baby, and the term what is given to it in medical terminology, it is called as macrosomia, just because the body organs are enlarged. So this is macrosomia, and the fact what I need to emphasize is it is only during the last trimester of pregnancy that the mother's weight increases and so the fetus weight. So it is only during that the baby is born with a weight greater than 4 kg, it is only in the last trimester of the pregnancy that the baby's weight is going to increase, and it can, if it is exceeding to more than 4 kgs, it is termed as a condition is called as macrosomia, and the baby is called as a big baby. Hello. Now, moving on to the term of the baby. See, the normal gestational period in humans, if we talk of, it is mostly ranging between 259 to 293 days. So this is the normal term, that is from the beginning of the intrauterine life to the time at which the labor pain occurs till the time when the pregnancy is completed. It is ranging between the time at which a baby is born is round about between 259 to 293 days, and it is called as the full term of the pregnancy. So the normal full term pregnancy is ranging between 259 to 293 days. But there are certain conditions where premature childbirth, premature baby is delivered. So in such a condition, now the different terminologies have been given. So what is a preterm baby? So if it is, the normal gestational period is ranging between 37 to 42 weeks. But if the baby is born in less than 37 weeks, means before the completion of the gestational period, below 37 weeks, in less than 37 weeks of gestation of intrauterine life, if a baby is born, it is referred to as the preterm baby, and if we count it in terms of days, it is 259 days. Moving on to the extreme preterm babies, if a baby is born at the completion of after 28 weeks, in less than 28 weeks, means below 28 weeks of gestation, below 28 weeks, it is referred to as an extreme preterm baby because a baby is born at the seventh month or close to it. So, if the gestational period is less than 28 weeks and a baby is born at this time, it is referred to as the extreme preterm baby. Now, when we talk what the next term is the very preterm baby, if a child is delivered at the 28 to 32 weeks of pregnancy, between 28 to 32 weeks of pregnancy, if a child is delivered, it is referred to as a very preterm baby. Next, moving on to the moderate to late preterm, if a baby is delivered at the end of 32 to between 32 to 37 weeks of gestation, it is referred to as moderate to late preterm babies. Moving on to the next, last but not the least, that is the post-term babies. If in certain circumstances, in certain situations, it has been found that the pregnancy is greater than 42 weeks of gestation, that after 42 weeks of gestation, if a baby is born that is greater than 294 days, or after 294 days of gestation, it is referred to as the post-term babies, that is approximately about 10.5 months. Alright, so this was a very short discussion about the gestational period and the birth, what is the weight, the certain basic facts about pediatrics, where the weight of the baby is concerned, how long is the pregnancy duration, and at what time of pregnancy if a baby is born. So this was a short video. In multiple choice questions, either in the community medicine or in the pediatrics, when we are supposed to answer, they will give you one-liners that what is a preterm baby? Less than 37 weeks, more than 28 weeks, 28 to 32 weeks, 32 to 37 weeks. So out of 4 options, we need to select a particular option. Okay. So students, this was a very short video. Thank you for watching. And students who haven't subscribed my channel and who are new, go do subscribe my channel and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.